What's new in skincare? How do we look after the skin? Because our saying is we want to be a kick-ass 80-year-old. So how do we get there?
Yeah. Let's look at the most inexpensive way to prolong photoaging is sunscreen and good sun protection. So the basics, staying out of the sun when it's high in the sky, taking your walks early morning and late afternoon, applying sunscreen, adequate amount of a broad spectrum sunscreen, anything from the shelf that you can get that's at least between an SPF 30 and a 50, and has good UVA and UVB cover. There are obviously sunscreens that work harder nowadays for us, and they come at maybe a little bit of a higher price, but it's still always worth it. If you are looking to start doing any type of aesthetic treatment, any type of active serum or cream that you want to incorporate into your routine, your first step is going to be sunscreen. You can pay hundreds and thousands of rands on anti-aging products, but if your primary sun protection is not there, because remember, those actives are going to make you more sun sensitive, and you're wasting money if you're not upping your sun protection game. So that's always going to be the first thing. When you go on a holiday, protective clothing, obviously keeping your children out of the sun, that's going to be the first point, and teaching them about good sun protection measures. Then what is new? I think if you think about going into your 30s and 40s, every single patient can at least be on a retinoid. A retinoid at night, whether that be retinol, tretinoin, the benefit that you will get from a retinoid, it ticks all of the boxes. You're getting anti-acne, you're getting anti-pigmentation, you're getting anti-fine lines and wrinkles. You're inducing collagen synthesis and banking in the dermis. You are smoothing out your skin texture because it increases your cell turnover, and you are regulating your sebum production. So all in all, it ticks all of the boxes.
And that is something you can just buy? Or
yes, You can start with something over the counter, a low concentration, and then as you start building up your tolerance, you can go to your GP or dermatologist and say, actually, I think I'm ready for a medical strength retinoid. And then we can tailor to your needs. I'll ask you, well, how sensitive is your skin? Do you struggle with other things? But a bit of monthly breakouts, if there's some rosacea, do you have very sensitive skin? And we can tailor a plan for you to get you on the right product. And it's all about building up tolerance to a retinoid. But definitely everyone, even if you can only tolerate it every second to third night, you can still get the benefit from it without having the sensitivity.
The skin is such a broad. I think we're gonna struggle fitting this in an hour. But quite a lot of our Innersight people are in their 40s to 50s, so they've now got children in their 12s to 22s and that, or in that puberty years. And while you were talking about retinoids, kids, can I take it?
So if we're talking acne, full-blown acne, the earlier the better. So doesn't always mean that everyone has to be on some form of an oral retinoid, but there are definitely teenagers who are going to benefit from it, and you rather want to do that earlier, before that whole inflammatory process has taken place, before they start scarring. It's the best thing that you can do for your child is to take them for a skin consult early on, when you see that the acne is kind of getting out of hand, more than what you can control with facial products. And then again, if it's mild to moderate acne, we can definitely start with topical products. There's wonderful things on the market, different generations of topical retinoids, and then you upgrade as your patient according to their needs. So some will fall into the category of topicals, some of them will fall into the category of orals. But would I recommend actives for young children? No. If there's no indication for it, a good normal regime of cleansing, moisturizing, and sunscreen is more than enough, even well into your 20s. I know there's a lot going on social media. I do think a lot of our older teens are over-treating and overstimulating their skin, and that's often where a lot of breakouts and sensitivity is coming from. So age-specific routine.
Is there, I want to come back to that point, especially with social media, but that's a question every now and then someone asks the question, because if you open social media, you're going to see, sunscreen is toxic. You get all these chemicals absorbed in your skin. Everyone's supposed to have an opinion on that.
Yeah.
And I suppose it's the pros and cons that you also need to look at if you're in sunny South Africa, weighing up the benefit versus other stuff. But is there specific brands of sunscreen that you would say is better than others, or does it actually make
ingredients?
Ingredients to avoid?
There's so much that I can say on this topic. So firstly, on the topic of, is sunscreen toxic? Does it cause cancer? Is it toxic to our reefs? This is an endless conversation, but if we just get down back to the basics, number one, there are much worse things that you're putting in your body that you're taking in through your mouth than the sunscreen that you're putting on your body. Most of the ingredients in sunscreens, the particles are too big for our skins to absorb. So most of them are sitting on the surface of the skin. So they are either absorbing the UV rays or reflecting them. And then we're talking about chemical and physical sunscreens. Where we start looking at nano technology, where they make the particles smaller for us to be able to make physical sunscreen, so the zinc and the titanium oxide more cosmetically acceptable, to not have that white matte look. They make them into nanoparticles. So there is studies ongoing to see how much of that gets absorbed into the skin. But then we have to look at dose. So if we're looking at the toxin, it's dose dependent. Anything that we say is toxic to the body, we have to look at, are we getting enough of it? So none of us are applying enough sunscreen for us to reach toxic levels. That's the first part. And the same goes for reef safety. If we're looking at the amount that we are kind of washing off into the water and threats to our coral, it's mostly environmental, actually. That is the studies they've done to pick up the amounts is the same as a drop into a Olympic-sized pool. So again, not enough. None of us are putting enough on again to get it into that. And then we're worrying about hotspots maybe, around the islands where there's a lot of tourism. Again, our carbon footprint is a much bigger problem. The water temperatures that are rising to, the effect on sensitive coral is much bigger. So that's the one side of what I will say, is that most likely the amount that you're going to be putting on is not going to be toxic to you or the environment at this stage. Secondly, if we look at sunscreen as a carcinogen, the sun is a much bigger carcinogen, and that we all know. If you've ever applied sunscreen unevenly, you know that it works. The area where you've applied it, your skin is fine. The area where you missed is blood red and burnt. So you know that it works. I don't think I have to convince anyone of that. And then if we look at ingredients lastly, so a great sunscreen, most of our big brands that are available on the market in our main pharmacies or stores will be an SPF of 30 or 50, have good UVA and UVB coverage. We're looking for long UVA because then we're getting kind of close to our visible light spectrum. A lot of newer sunscreens now on the market have done technology and added filters in to give us visible light spectrum coverage, and that is important for pigmentation. So if we're looking at our darker skin types, they're more prone to pigmentation, or people struggling with melasma, we want visible light coverage. And then cosmetic acceptability. So I say to patients, if they ask me what is the best sunscreen, I'll tell them the best sunscreen that you can have is one that you will be willing to wear every single day. So if it's nice and thin on the skin, it doesn't feel sticky or tacky, and it doesn't leave a white cast, which is important for people with darker skins because no one wants to look ashy or grey. So something that you enjoy putting on, that you can see you're going to make that part of your routine, then I'm happy with that. Things with nice hyaluronic acid in them, they spread easily. You need only a thin layer, and you are able to reapply maybe a second time. For a woman wearing makeup, that's a very big thing. They come in powder formulations as well, which I think is great for touch-up, maybe not as your primary formulation, but a lot of them are so spreadable that you can easily apply it over makeup during the day.
And something you also get an oral sunscreen, like some of the products like HelioCare. I think they make a tablet that you can take.
Absolutely. They make a tablet that contains their fern block technology. Where I would place that, again, is not a primary sunscreen. That would not be your primary sun protection. That is an add-on. So where it's wonderful is if you are going to have a binge episode of sun. So you're going on an island holiday for the next week or two. You're going on a skiing holiday for the next week or two.
Mountain biking.
Exactly. You're going camping in the Kalahari. You're going to get a lot of sun and you want that extra layer of protection. Or for your typical patient who has that higher risk already, who has had skin cancers. There are other things on the market, something like nicotinamide or niacinamide, 500 milligrams twice a day is a wonderful thing that we use. It really makes a difference for patients. They come back and ask for it. So it helps them with the inflammation. It helps to decrease the formation of those new precancerous or actinic keratosis lesions. So yes, there are oral things that we can add on, but they're not the primary thing to rely on. They have a place, but it's a specific place.